everyone, welcome to Ask Giri, the Physio Show, Season 3, Episode 18. Today's topic is myths and facts about neck and back pain after car accidents. We see so many patients in the last 20-25 years with so many different types of car accidents and different types of injuries with male, female, elderly, young patients, and there is always some common myths and facts existing among them, which I want to clarify now. Especially at this point of time, so that the winter is here and more car accidents can happen. Unfortunately, if you met with a car accident or you or your family members, what you should know and what is the truth, what is not a truth. Okay, let's talk about 10 myths and facts, short and sweet, so that you are knowledgeable about that. When you get in an accident, when you go see your healthcare practitioners and they'll educate you about your injury and everything, sometimes you might hear from some practitioners that your joint is out of place, right? Your joint in the neck is out of place, or back is out of place, is gone out of place, or sacroiliac joint is out of place and we have to put it back in, or things like it happens very, very, very rarely. When you say out of place, it's a dislocation, right? You have a tremendous amount of trauma to dislocate sublux your joints from out of place to get into the situation, right? Not very common at all. That kind of vocabulary we try to avoid when we educate the patients. It creates a lot of fear in their mind, and that is not good for you for your recovery, right? Most of the times your joints are strained and ligaments are strained, muscles are strained, which need some gentle mobilization to get them moving because they are stiff. Okay, it's not everything is out of place. So don't be frightened when you hear that types of vocabulary. Please make yourself understand better and ask for some more clarification about it. Okay, not everybody dislocates the spine. Most of the times when your neck and everything, if you're dislocated, you will be in ICU with morphine drips. If you're walking into a clinic for a treatment, most likely your spinal joints are not dislocated, right? So that's very important for you to know. We talk about all these preferred providers things going on, right? So what happens is insurance companies, the big insurance companies, have certain clinics as their preferred providers. That means they are met together, they lobbied, they had a meeting, and they said, hey, when your claim owners call you and you make sure they come to our clinic, so we'll take care of them. So they consider preferred providers. So, but as a common man or a common woman in the community, you have the right to choose your physiotherapy provider. If you have an accident, you call the insurance company, their adjuster saying, oh yeah, I got your claim and everything ready, I would like you to go to this clinic. They can suggest that because they do have some preferred providers under the toolbox, but it's your decision. You can always say, hey, I already have a physiotherapist, or I've been seeing a physiotherapist for 10 years, I would like to go to him or her. So that's your right. Do not forget your right when it comes to choosing your physiotherapy provider after car accidents. So that's, a lot of people do not know that, because sometimes people come to us saying that, oh, my adjuster told me to go to that clinic and I went there and then, whatever happened there. So that's what I want to know. You're right. Based on that Alberta motor vehicle accident law, you are covered for treatments. Okay. So when you're in an accident, if you have a valid insurance coverage, you are covered for the first 21 physical therapy, chiropractic, massage, acupuncture treatments. So sometimes what happens, the adjusters are very busy. They might take some time to send you the forms. So you don't have to sit at home with pain, with your acute pain, your headaches and everything, wait for those forms. Most of the physiotherapy clinics in here have those forms in the clinic. So basically you have to call a clinic and make an appointment and go see your physiotherapist. They will give you the forms, you can complete it, and physiotherapists have to complete a form. Then we will send it all together to the insurance company to start your claim. So do not sit with pain at home waiting for those forms. Once you inform your insurance company, seek help right away. Do not wait, because the first 6 weeks is acute stage and a lot of things happens at that time. So you need care immediately by your healthcare provider. Whether it's a physiotherapist or chiropractor, it doesn't matter. Give appropriate care right away as soon as possible. With whiplash injury, which is like sudden movement of your spine, like a whip, it has 3 classifications, sometimes even 4, and different types of injuries and neurological deficits and everything. Let's not get into detail of that. But if you have a whiplash injury, if somebody rear ends you or sidebound you, sideswipe you, or a front collision, whatever it is, you can injure multiple areas, multiple body parts. Don't think it's just one joint and one muscle. You can injure multiple joints, muscles, fascia, in your spine, in your shoulder, in your jaw, in your lower back, and elbows and wrists, knees, ankles. And also sometimes if you hit your head, sometimes you hit your head, the airbag deploys, hit your head, or sometimes you hit your head on the window, or very forcefully on the back of the headrest, and or with the other passenger if you're sitting in the back, right? If it happens, you can also, or may also, can have concussion, which is brain injury. Okay, you can have a mild to moderate brain injury also during that car accident. So when you experience that symptoms like headaches and vomiting right away, that means you know there is some bigger trauma to your head and your brain. So you need immediate help right away. You have to go to an emergency, get it checked by your medical doctor, and then come and see your healthcare practitioner, the physiotherapist or chiropractor, and as soon as possible, right? That's very, very important. So always remember, it's more than one muscle or one joint is injured in whiplash, and you can have concussion also sometimes if you hit your head anywhere in the car. And also, dizziness and headaches are very common. Okay, dizziness can come from your brain, from your upper neck, from your inner ear. It can from your jaw. So all these structures can give you dizziness. So and headaches also. So make sure that you get it addressed right away. And this is a small slide about to understand about the whiplash and car accidents, like, you know, what is the percentage, what are the things you need to know. Maybe spend some time about this to understand and educate yourself. Maybe pause the video now, go through the slide, read, so that you are knowledgeable. If something happens to you or your family, you are having a first-hand knowledge about what it is and how to seek help and when to seek help and whom to seek help. That's the whole point of this slide, for you to spend some time. What are the common symptoms? What are the different types of whiplash associated disorder? That's called what grades, and what it is mean. So please spend. It's very common, very, very common injury actually. You can also get whiplash injury in sports injuries also, not only car accidents, but our topic today is all about car accidents. Okay, so that's what it is. So yeah, please pause the video, take a couple of minutes to go through this slide for your information. Myths and facts number 4. I already told you, you can also hurt your jaw. When I say jaw, we got two joints here. The joint is called temporomandibular joint, right? And then this whole thing is your jaw. So you can hurt this joint because this joint mechanics is very closely related to your upper neck. Okay, your upper neck and your jaw, they work very close together. When you have a very good whiplash there, you also injure your jaw. Sometimes your jaw opens and closes during the whiplash also, and along the head injury also. So when you get any jaw pain, sometimes dizziness and headaches come from the jaw pain itself. It doesn't have to come from the neck. So you have to immediately consult your physiotherapist, your dentist. Sometimes we refer you to a temporomandibular joint specialist, and also you seek help from physiotherapists. A lot of physiotherapists are very well trained in TMJ management. That means temporomandibular joint pain management. Okay. So we are very well, we have taken a lot of different courses to work on the joint internally, externally, and teach you right exercises. And if you need it, we'll refer you to a dentist for splinting and other things also. So I want you to remember that you can hurt your jaw, then jaw can give you dizziness and headaches as well, right? And it can cause bite change also. Myths and facts number 5. Your thoughts matter. Okay, very, very important, because there's a saying by Charles right there, you know, life is 10% what happens to you and 90% how you react to it, right? If you're in an accident, what happens? You know what goes on in the mind. I've been in an accident, maybe some of you may be in an accident. Right away, my goodness, why this has to happen to me? Why now? I got kids in the back, I got a new job, I just bought this car, brand new car, right? We have one car in the family, now what are we gonna do? Or you might have two cars, now one car is gone, how are we going to manage, you know? You have to drive to work, your wife has to drive to work, who's going to drop the kids, who's going to pick up groceries, who's going to take kids to hockey after work. There's so many things goes on, right? You're very distressed. You have to deal with the insurance company, you got to take the car to the shop, right? You got to take care of the family stuff and work stuff. It's just way too much. That's when you got to really, really be very calm, have positive mindset. Okay, this happened to me, that's fine. I'm going to deal with it now. Let me first take care of one thing at a time. Inform the insurance company. Okay, if I'm hurt, let me call my insurance healthcare provider to make an appointment. So let's insurance providers, most of them, they have their own body shop nowadays. Take the car and give it there. Most of the times you can get a rental. Get the rental. So your ride is fixed, your health is fixed, your emotions you got to control, right? Instead of Just telling, oh, I'm a big mess. I'm a human, right? I'm prone for accidents and incidents. It can happen to me. I'm going to deal with it now. So take it that positive, right? And you can do hard things. Your brain is very powerful. You can have a positive thoughts and positive mindset. Get appropriate help. Have a good team around you. A good doctor, a good physiotherapist, good lawyer, a good dentist, good auto mechanic guy, a good insurance company adjuster. If you have a good team like that, and you're going to have a very good recovery from emotional distress and physical distress as well. Right? So that's why we have positive thoughts. It's very hard to kind of implement that, but you can do that. You can have very positive thoughts, okay? And get right here. Number 6, it's all about pain management, pain neuroscience, okay? The pain neuroscience guys have changed so much in the last 25 years. What I studied in school has changed so much now because I'm constantly updating myself, and also a lot of physiotherapists are doing the same. And what we know about pain now is beautiful, right? And it's more it's a behavior, right? It's a protective behavior. It's an expression. It's not anymore just a prick of pain. Oh my God, pain. It goes to the brain. Oh my God, pain. Not that anymore, right? It's more than that, right? And you can tune your pain up and down. Never forget the strength you have, right? And I'm not talking about medications. I'm not talking about popping a pill and taking the pain down. No, just by your thought process. That's why I said thoughts are very important. Just by blocking all the negative experiences you had before and waiting for a positive outcome from this injury and having a correct team members, and that all matters. Okay, we're going to talk about that because your brain has a medicine cabinet. Because if you want more information about this, you should watch my previous episode on pain, brain, and dim sim. If you haven't watched that, please go watch that episode at physioshow.ca and you will understand. I did a whole episode on this one. I'm going to very shortly, I'm going to tell you about it. We do have a beautiful medicine cabinet in your brain, okay? That medicine cabinet has some of the most powerful medicines, opioids in there, very powerful. Your own body creates them, and very powerful endorphins and things like that. But in the medicine cabinet, it's locked. It can drip the medicine down in the spinal cord into all the areas. Okay, what can open the medicine cabinet? You have the key. So because you have the key is your thoughts, your emotions, and your education, your knowledge, right? And the lack of fear, all those things, and your breathing pattern, they're all the keys for opening that medicine cabinet. Because the medicine cabinet communicates with the different centers in your brain, and the different centers communicate to the medicine cabinet to open the medicine cabinet, to give your own drugs to yourself and to get better. So again, I repeat, your thoughts, your emotions, okay, your past painful experiences and how you think about it, and catastrophic things, what you hear from the others, what your other medical practitioner, your friends say, oh my God, you are in an accident, you're never going to get rid of that neck pain. You're going to have pain all your life. Oh, that's a bone on bone. Oh my God, your MRI shows a disc bulge, you're done. Right? These kind of things you hear, you're going to have a lot of negative thoughts and bad experiences with that. You're going to create a lot of fear of movement, and that's the worst thing you can have. All this is going to lock your medicine cabinet more tight. So, if you want to open your medicine cabinet, positive experiences, positive thoughts, and also good team around you, less fear of movement. It's very, very important. And knowledge is the king, right? You develop knowledge like watching episodes like this, and develop your knowledge, proper channel you get the knowledge from, and you're going to be smart enough to deal with things actually, right? That's very important. So, you have a medicine cabinet, you have the key, it's up to you to open it or not, and how to get better from there. Myths and facts number 7. The amount of pain you're feeling, it's not equal to the damage in the tissues. For example, you feel like, oh, after the accident, you're very stiff in your neck. You move your physiotherapist is asking you move your neck. You move your neck. Oh my God, it's hurting. Oh, but don't think that when you move, that pain you're experiencing, you're hurting something more. Okay, pain is not equal to tissue damage. Always remember that. Okay, pain is a protective behavior, right? So the brain wants to protect you, so it's telling you, oh my God, don't move. But little bit of pain is okay when you move. Your physiotherapy is a good guide for that. Okay, it's not like no pain, no gain. You have to push through pain. No, I'm not saying that. What I'm saying is a little bit of pain. I always tell my patients, if your pain is less than 4 out of 10, you're okay to do that. You can handle that, right? So everybody's pain perception level is different, but we work with you. So I don't want you to think when you move, if you get a pain, that you're damaging something. It's not only for the neck, it goes for all the joints. So talk to your therapist about it and educate yourself more about it. So the bottom line is pain is not equal to damage, right? Myths and facts number 8. Your spine is a very, very strong structure. Sometimes you might hear from other sources, practitioners, that make you feel that your spine is a very fragile structure. It's not. Your spine is such a strong structure. Yes, it can get hurt here and there when you play sports, when you fall down, when you're in a car accident, but you can heal that. You can retrain that. Get the movement back. Once you're pain down, movement back, and then you start loading the spine, introduce more movements to the spine. It's going to do wonders. Okay? Do not feel that you're such a fragile structure, you have to something you have to protect. You can't move, you can't bend, you got to tighten your core to walk. Just don't do all those things, right? Educate yourself and consult a good therapist. He will guide you through the process. He or she will guide you through the process. Always remember this. You heard it from me. Your spine is a very, very strong structure, irrespective of your age, right? So as you age, yes, there is some degeneration here and there. Your disc can degenerate, your joint can degenerate. That's only aging process. It's not a disease even. That's the way. It's like a gray hair, right? You can't prevent the changes, but you can always make sure that you're living a healthy, happy life despite the degeneration, despite the injury, despite the trauma. You can get better with a good help. So always remember that. The myths and facts number 9 is all about the nerves, right? So when you're in a car accident, you can also injure or traumatize the neurological structures. It can be your brain, it can be your spinal cord, it can be your peripheral nerves. Most of the peripheral nerves comes from your spine and come out and supplies the different muscles and the skin and the organs, right? So when you get tingling or numbness, it's a warning sign. You know your nerve is not happy. When you have a sharp, burning, shooting pain, you know you hurt your nerve. Your physiotherapist can examine nicely and tell you nerve is involved or not. It can be your brain, it can be your facial, it can be your cranial nerves, it can be your peripheral nerves. Okay? And the main thing is your numbness, tingling, all those things, it's a warning sign. And we have expertise to do manual therapy and exercises to take the pressure off the nerve and help with your medical team to get you better and get rid of the neurological symptoms. Right? Because right from the peripheral nerve injuries to the traumatic brain injury, we are equipped to deal with your problem. We can give you proper solutions for that. The last but not the least is emotional distress, right? We talked about how your thoughts matter and also your emotions matter. You can also experience so much of emotional distress when you're after an accident. As I told you before, that's because of so many reasons. First of all, you are injured, right? You want car shot, or you don't have money to repair, or you don't have proper insurance, dealing with insurance companies, and there's snow outside and dropping kids. There's so much going on. That's when we approach you psychosocially. So even though physiotherapists are just movement specialists, we call it, we are more than movement specialists, right? We are a health coach. We're going to talk about your sleep, your nutrition, your hydration, your social life, everything, your breathing, your mindfulness, everything. Okay? We are not just movement specialists. If help needed, we're going to refer you to a psychologist who can help you more if you're in emotional distress or if you need psychological counseling. But as a physiotherapist, we also gone through a lot of psychological course materials and a lot of psychological courses to deal with your problem. And also we are trauma-informed physical therapy practices. That means we are educated ourselves, we are certified in trauma-informed care. So car accident is a trauma. So we know how to deal with that emotionally as well. So do not think we are just only about physical health. We also worry about and take care of your mental health. And if appropriate referral is needed, we're going to refer you to a registered psychologist in town. Okay? So these are the myths and facts. Hopefully you learned 1 or 2 new things which you didn't know before. If this is helpful, please like and subscribe. Physio Show, Ask Giri Physio Show in YouTube. Also go check out the website physioshow.ca, and there is tons of contents there for you to educate yourself and empower yourself. Okay? Good luck.